Sugarcane processing, chemicals, safety, and health risks. Sugarcane, a tall tropical grass, is one of the world's primary sources of sucrose. While the raw plant contains fiber, minerals, and antioxidants, the industrial process of converting sugarcane into refined white sugar strips away nearly all nutritional value. The transformation involves multiple chemical steps designed to clarify, decolorize, and crystallize the juice into pure sucrose. Sucrose, commonly known as table sugar, is a disaccharide composed of glucose and fructose. Excessive consumption of sucrose can have negative health consequences. 1. Processing. Stages. Extraction. Sugarcane stalks are crushed to release juice. Clarification. Chemicals are added to remove impurities. Evaporation. Water is boiled off to concentrate the juice. Crystallization. Sugar crystals form and are separated. Refining. Further purification removes color and residual non-sugar compounds. 2. Chemicals used in processing. Lime. Calcium hydroxide added to raw juice to raise pH and neutralize acidity. This causes proteins, fats, and organic acids to coagulate and be removed. Lime is derived from limestone and is considered safe in small amounts, though industrial exposure can irritate skin and lungs. Carbon dioxide carbonatation bubbled through lime-treated juice to form calcium carbonate precipitates. These trap impurities and clarify the liquid. The reaction is self-limiting and does not leave significant residues. Phosphoric acid phosphatation used with lime to form calcium phosphate precipitates. These attract waxes, gums, and other non-sugar impurities. While safe in trace amounts, excess phosphoric acid in the diet, e.g., from sodas, may contribute to mineral imbalance and bone loss. Sulfur dioxide sulfitation, a bleaching agent and preservative. It inhibits microbial growth and lightens color. Sulfites can trigger respiratory symptoms in sensitive individuals, especially asthmatics. Regulatory agencies limit residual sulfite levels in food to minimize risk. Activated carbon used during refining to adsorb colorants and impurities, derived from wood, coal, or coconut shells. It is highly porous and effective. However, carbon from coal may carry heavy metal contamination if not properly purified. Bone char, a traditional decolorizing agent made from charred animal bones. It removes color and some inorganic compounds. While effective, bone char raises ethical concerns for vegans and religious dietary laws. Many brands now offer bone char-free sugar. 3. Safety considerations. Most chemicals used in sugarcane processing are classified as processing aids, meaning they are removed or neutralized before the final product is packaged. Regulatory bodies like the FDA and EFSA monitor residue levels and set safety thresholds. However, cumulative exposure from multiple processed foods can be problematic. Cumulative risk factors: bioaccumulation. Trace residues from sugar, beverages, and processed foods may build up over time. Synergistic toxicity. Multiple low-level exposures can interact and amplify harm. Vulnerable populations, children, elderly, and those with chronic conditions may be more sensitive to chemical residues. 4. Health risks of refined sugar. Even without chemical residues, refined sugar poses significant health risks. Metabolic dysfunction. Rapid absorption causes blood sugar spikes, insulin resistance, and increased risk of type 2 diabetes. Cardiovascular stress, linked to inflammation, high triglycerides, and arterial stiffness. Obesity promotes visceral fat accumulation and disrupts appetite regulation. Dental decay feeds oral bacteria, leading to cavities and enamel erosion. Mental health may contribute to mood swings, anxiety, and depression. Immune suppression. Excess sugar impairs white blood cell function and promotes systemic inflammation. Addictive behavior triggers dopamine release, reinforcing cravings and habitual overconsumption. 5. Ethical and labeling concerns. Many consumers assume sugar is natural, especially when labeled as sugarcane sugar. Unless specified as raw, organic, or unrefined, it likely underwent full chemical processing. Sugarcane sugar may be used to avoid GMO concerns associated with beet sugar, but it does not guarantee minimal processing or ethical sourcing. 6. Safer alternatives. Raw cane sugar retains trace minerals and molasses. Organic sugar avoids bone char and synthetic chemicals. Coconut sugar, low glycemic, minimally processed, date sugar, whole food, fiber-rich, maple syrup and raw honey, natural sweeteners with trace nutrients. Conclusion: Swagar's processing transforms a nutrient-rich plant into a refined product with minimal health value and potential chemical exposure. While regulatory bodies deem the final product safe, cumulative dietary exposure and metabolic effects raise valid concerns. Choosing minimally processed sweeteners and reducing overall sugar intake supports long-term health and ethical transparency.